My name is Jonathan Calderon, and I'm a general dentist practicing in Satellite Beach, Florida. One of the things I love about my practice is that I get to see patients of all ages, and a unique experience I've had is treating children with autism. I've enjoyed the challenge of getting to tailor my practice in a way that fits the needs of the patient so that they can learn to not only take care of their teeth with my help, but also learn to take care of their teeth on their own. The American Academy of Pediatric Dentistry recommends that a child begin seeing a dentist when they get their first tooth, which is usually sometime between 6 months and a year. Children will start receiving routine dental care, cleanings, exams, as they get more teeth and as they're able to sit in the chair. Finding a dentist who has experience working with children with autism can be a little tricky. One thing you can do, of course, is just simply call the dental office and ask if they have experience or if they're willing to see the child. Secondly, there is a website, autismspeaks.org, and under their community resources page, you can find links to dentists who have signed up when they are willing or trained specifically to work with children with autism. Before booking an appointment for your child at the dentist, it's important to ask a few questions. First, I would ask to know if it's possible for your child to see the same dentist and the same hygienist at each appointment. The consistency is important in creating a routine and helping your patient or your child feel comfortable at the dental office. Second, I would ask to find out if they're willing to accommodate special appointments for your child, whether before or after hours, or perhaps at a time when the office is less busy. Less chaos and less stimulation can help the appointment go more smoothly. And finally, I'd ask if they would please send you the paperwork ahead of time so that you can arrive to the appointment ready to go in. That way you and your child don't have to wait, which can create anxiety or anticipation, and also that way the dental office can be ready to meet the specific needs to make your appointment go smoothly. A parent can prepare their child for their first dental visit with a few simple steps. First, it's important that the child is able to sit still with their mouth open. It's also helpful if the child can keep their hands on their stomach and keep their legs straight out in front of them. That's how they'll be sitting in the dental chair. Second, most of the instruments that we'll be using during their first visit can be bought at a drugstore. A flashlight, a dental mirror, and a tooth counting device can all be picked up, and the child can become accustomed to having them in and around his mouth. Finally, I think it's important for the parent to bring the child with them to one of their dental appointments. That way the child can see that not only is the parent safe and comfortable, but the child can have a positive interaction with the dentist and become used to the dental staff and the dental office. Before their first appointment, it's important for your child to have a few simple skills. First, your child needs to be able to sit still with their mouth open. That's going to be the most important part for examining your child's teeth. Secondly, your child should be comfortable with instruments in and around their mouth. It's helpful if your child can follow simple instructions, and it's also helpful for your child to be able to swish and spit. When working with the dentist to create a treatment plan that's appropriate for your child, it's important that you communicate with the dentist anything that might be aversive to your child. For example, if bright lights are a complication, we can ask the dentist to dim the lights. If the child is sensitive to loud noises, perhaps you can bring a song or music or headphones that's calming to the child. That way the child has something that's not only familiar, but something that will distract him from the noises of the treatment that's going on. It's important that you and the dentist are patient. You have to be willing to be flexible and change the treatment at each appointment based on the child's needs and behavior. You may have to reschedule some treatment for a later date. You may have to do less treatment at today's appointment. And always remember, giving positive feedback to the child and making sure that the appointment ends on a positive note is always very important to helping the child feel comfortable and helping the child come back to receive more care. Helping maintain your child with autism's oral health at home is no different than any other child. You want to teach them to be able to brush and to floss their teeth daily. Working with your child is going to take some creativity. For starters, there's no reason the child has to brush their teeth in the bathroom. If the child is more comfortable in his bed or in the dining room or on the sofa, work with your child to brush their teeth there. The goal is to get the child's teeth clean. It doesn't matter where it happens. Secondly, I always encourage parents to start off with a regular toothbrush. Electric toothbrushes work well, but they create a lot more stimulation. Always use a soft toothbrush because it's more gentle and is less abrasive to the child's teeth and gums. Secondly, be sensitive to any tastes that your child dislikes. There's lots of different flavors of toothpaste that you can use, and also if need, don't use any toothpaste at all. Cleaning them with a toothbrush is still better than cleaning them not at all. When working with your child to brush and floss their teeth, it's important that you remember that this is a long-term goal. It's going to require patience and flexibility. You're going to have to be creative, and you're going to have to remember that it's small steps that will lead to your child being able to brush his or her teeth for a lifetime.